I am dog tired, boss. But I'm here and I got a lot of information. And because we got work to do, I'm going to just jump right in. Appreciate you for joining. Be sure to hit that like button, helps that message move forward. As well, you can go on and share it with a friend. But because I got a lot of work to do, I'm going to jump right into it. Hope you don't mind. But let's see here. First and foremost, like always, I do like to bring in a little bit of music throughout the conversation just to ensure that my energy levels can stay at a good optimal pace. But more than that, because I value music and today's Friday. So I do got some great tracks here, great content, and hope you enjoy the stream. All right, so it's a lot of information, so y'all rock with me here. Let me see if I can bring it up here. First and foremost, I actually do want to start that music, so let's find it here under Lessons Over Music. I should share this screen, which is the background process. That way I have that as well. Once I'm in the Lessons Over Music, name the folder MP3 files. Let's see, which one do we want to start off with? Let's start off with Hooligan. Y'all be sure just to let me know if that starts kicking up a little bit too loud. I'll be sure to come back in and check it out in a minute. But it always be one salute to the first, be first. And the first person I see there in the chat is my big brother, George, making two. So we got a CoronaNoia topic that we finna hit from a number of angles. Number one, I want you to understand these political undercurrents that are going to be replete throughout this story, right? I got a number of big hitting stories that are going to be throughout this message. So if you can rock with it for the duration, I salute you already. And if you just need it in sound bites, there will be music breaks in between. So you can pick right up where the music goes on and off, and you'll find yourself re-engaging in the information without losing that pace. So that's number one, and that's number two. Let's see here. We're going to start here, which is the big story, of course, and then from there we'll let the beat build. And so we're going to start with that one there, which is, I'm going to share the screen this way, but I also have the information in a more condensed format for our records moving forward. As you know, we are chronicling this experience together, and so hopefully they rock with us. When I show the screen, the sources are on the screen. In this case, the hhs.gov. Now that's a big one, right? It's dealing with the Department of Health and Human Services, and we know that the department or subsection therein is the Office for Civil Rights. Again, that's hhs.gov, and the Office of Civil Rights, that's OCR, Office of Civil Rights, reaches an early case resolution with Alabama after it removes discriminatory ventilator triaging guidelines. Let that sink in as the beat builds. How is the volume? Go on and post that in the chat. That is the big story right there, the one that deals with race. And in this case, it deals more with age than race. So understand the ramifications of that. I'll zoom in just a little bit so we can get it from their words, and then we'll give some context after that. I want you to zoom in on this position right here. That's it right here. For research purposes, be sure you check that out. Draw your own conclusions. This is the big one here. Certain disabilities for unfavorable treatment or use of categorical age cutoffs. I didn't like this part, disavowing. Did a little bit of further research on it just to see what they had going on. The HHS seems about the family, Title 10. And so that's interesting, right? Some cases that they've looked at or some of the reviews that they've had to conduct. They issue notices of violations of federal conscious statutes too. A couple of universities, if you want those sources, to look it up and see what theirs is. Now, I've done a bit of this work already. And there's deeper ramifications that one might be able to dive into. So check that out and understand. These are deep topics, even some that are at the Supreme Court to be ruled on. They're in recess throughout the pandemic, but keep it rocking here, because the basic premise here is when we're doing research, we start with the source they tell us to go to. And in this case, that was the Center for Disease Control, so the CDC.gov. And then from there, ask those certain questions, find if we're finding the information that we're needing in order to continue to protect our elders, and those folks being our families, right? So getting to the meat of this conversation is this right here, this caring for yourself at home. And this is still just the context. When it comes to caring for yourself at home, there's two things that come to my mind. Number one, mandatory testing and mandatory reporting for number two. I mean, but as you look at it, they go straight to the solutions, to each their very own. You know your body better than me, so, and I'm not one of those pathogenical, naturalist folks. But the information that I was looking to confirm or to verify, the information that I was still seeking, was to answer this question about that report that came out of China related to male fertility. And I know that is a touchy topic there. But as you see here, the one that we wanted to bring out there, as we were looking to confirm based on their website, this one right here. Male fertility. So that is one of the major themes of the stories we've been following. And now with that, I've shared the screens that they had for us here. We'll take it one step further. And the next step here is that Johns Hopkins University data, the maps. What you're doing is you're trying to check. So you're looking at the data as it expands over time and as it gets sharper over time, not just the message of what they're telling you to interpret from the data, but you're actually looking to see where that data lands. On this screen, there was a couple of things that stood out to me. Number one is that there is a wide range of reporting capabilities based on the country, based on the state, if you're in the United States, even all the way down to the hospital level, a wide range of reporting capabilities. And that's going to be important, right? Especially as you start looking into our urban plight, as you look to protect our elders. So you'll see where I come from, a good city of Sacramento, California. There were 24 deaths. Right above Sacramento, you have, that is a city, right? 24 deaths. But then you look at right above it, 24 deaths reported in South Africa, which is an entire country. And so that shows the full extent of the reporting capabilities. It also goes deeper and starts talking about the testing capabilities. And those are important, again, because you're asking someone to stay home, but what is the follow-up? And that follow-up being, you're either going to allow them to not identify and not report, or they at some point will have to be tested, or, they just don't test. I don't know. but you do know that they're there, and you do know that there is a reporting gap that has to be filled. Those are the premises of this conversation. You see here 24 deaths in Estonia, 24 deaths in Burkina Faso, and then 24 deaths in Benton, Washington. And then right above that at 25 deaths is a city, Dallas, Texas. Right above Dallas, Texas is the same 25 deaths in Tunisia. An entire country has the same number as a city. Why is that? I tell you, it's because of reporting capabilities and that gap from a country level, entire countries that are not able to report out how many people in their entire society are positive carriers, have contracted the coronavirus. They just can't tell you. And for the most part, that's where this conversation is about testing capabilities. And it gets to the home front, because that question then is, as a citizen, do you have a moral obligation to report? Do you got to call a doctor if you start feeling symptoms? Now, this story is deep, and this story has a lot of moving parts, which is why there was a big pretext. It's been about 10 minutes in, and as we see, this song has played in repeat. This means this is my countdown for this one as we move forward. I'll let the beat build. All right, you ready? You remember the background story all the way back in December 31st, the Wuhan city, Hubei province. Now the Wuhan virus is the second wave that they say could be coming. Stay informed, all right? Because in January 13th, Thailand reported the first international case outside of China. And then from there it moved, January 20th. Around the same time, there were decisions being made. But I can show you for 8/2020, 1.4 million confirmed cases, 307,000 of those, plus or minus. See, here's where that reporting gaps. You see there in the middle of the screen, the big map from Johns Hopkins University. Total deaths at that time, 83,000. And they can break it down. You see the leader there being Italy, 17,000 deaths. Then Spain, France had about 10,000. New York City, a city being compared to entire continents, had about 4,000. 307,000, give or take, said to be recovered. There you'll see the U.S. at about 6. 22,000 recovered. So those are folks who said they had it, they reported it, and they were tested, and they verified that they were positive carriers of the coronavirus. This map here, this data shows you that increase over time. And I told you to look back at December and push it forward to around March the 13th. That's why this conversation is ongoing. That's why it's important, because as you'll see around March 13th, and I'm gonna zoom in for you without even touching it. I'm gonna zoom in for you, and you will see that around March the 13th, something happened in our media. And the majority of those whose main source of Fox News, around 79% of them said that it was exaggerated or slightly exaggerated. Almost 8 out of 10 of those people were not taking the coronavirus serious. So by 4/9, 1.5 million, 346,000 said to have recovered. So they're moving people who have tested positive into the recovered spot, but they're still struggling to identify and get those capabilities and resources on the ground into the average household. Regular consumers are not going to get that test, even if you wanted it. So while you can see 1.5 million confirmed, we still don't know how many have it, and still have that 14-day gap before they even become symptomatic. 93,000 deaths, that keeps going up, and we can keep having a conversation in depth about those deaths. 18,000 in Italy, 15,000 in Spain, 12,000 in France, 7,000 in the United Kingdom. And with that, the beat has effectively built. I'm going to cut it off and just let it build here. with just a conversation. You see 184,000 countries impacted in some way, some form. Now, some of those countries are at the bottom of the list with our states when it comes to getting resources. And that's an issue, right? That is a logistical nightmare when it comes to healthcare infrastructure and the demand not being met for supplies that could help save lives. And not only is that a country thing, it's also in those cities who at this point have a varying range of reporting capabilities. The need is tremendous, and there is absolutely nothing that they can do about it except find new sources for data substantiating the same thing we already know to be true. That there are many cases that are not reported and therefore not tested of coronavirus. See it jump from the 1.5 million to the 1.6 million total confirmed cases. I like this one. I think this one was actually invented by a 17 or a 19-year-old, but it is a very clean presentation of information. Now, deeper than just calling it information is when you start looking at like that top right corner and you see USA COVID-19 stats, and you see it broken down by cities or states rather: New York, New Jersey, Michigan, California, Massachusetts, Pennsylvania. You see that big total at the top, 468,000 confirmed cases. 500,000 right there. And you can keep looking back at Asia if you would like and see 133,000 and start asking questions about Asia and whether or not they're underreporting. Or we can focus right there in that top right corner where it says USA and think about our elders. And with the end of that slideshow, that is that content section. I'm going to continue to allow this information to build. And in the meanwhile, let me select our next track that we will be having this conversation to. With that, I'm jumping into the Spanish Trench because this is a little bit more deflectionary conversation. Y'all ready? CoronaNoia updates. Gotta have this, which is a TED Talks watch party when we look at that Bill Gates pandemic prediction, and then we can also put his more recent one on the right side. Watch both of those together, then break them down as a network and see what it is our people are actually missing when it comes to spreading this information. They're missing the Bill Gates conversation. They're missing key conversations that are being held from the World Health Organization. They may hear Trump say, cut the funding, $500 billion per year to the World Health Organization. They may get that line, but they may miss the real story of what's being said about contact tracing. And so we have this information that's going to come across your screen in a more rapid fashion, a regurgitation of information that is, because we have the numbers and we have a storyline. We have work to do. And I've said it 3 times. We have to understand where we are as a people. How do we situate in this increasing tide of information about the coronavirus? It's spreading. We know that to be true. This Spanish Trench, this infection, this coronavirus that causes a respiratory infection called COVID-19. And so we continue to ask those deeper questions. Is this true patient data? Or is this just best guessed? Because we know that we've surpassed 1,600,000. Now, remember, I gave you a pulse check. I gave you some valuable information on the who's who on B1 Brother Moses YouTube channel. I've watched 10 too many videos. I mean, come on, after the weeks that we've had, I'll give it to you like this. while I was preparing this information for the coronavirus, my wife walked by and asked, who is this basketball player that I was about to put on blast, and did he catch the coronavirus? And that was at a time when 8,876 more confirmed cases. That was pretty significant, but we started moving and seeing that number jump up to more than 10,000 a day. They can write it off and say that it was just because we increased our capability to test, or they can actually say that it confirms that there are carriers of the coronavirus out there that we just don't know about yet. And as we continue to get them to trickle in and to increase our capability to have that conversation with them, to get them to determine to voluntarily test, then we can see the true numbers representative in our society. And so as we'll see here, that March 13th number, you see the dotted line above it, it was around 8,000 or 8 to 9,000 rather per day. But that number grows there, as you see, from January. And then you see it on March 13th. That is the increase, and that is the daily number. And we attribute that to when this report came out and started giving us information about where were you getting your information? Exaggerated risks. Can you dig it? Now, I'm going to move forward because there is a lot of information we have to discuss. Like, what else happened on March 13th? Well, the Michigan governor dodged that martial law question. And she said, where the facts and science dictate, thus the World Health Organization. And she kind of gave us that red flag of it is too early. It is too early. See, they said that it was exaggerated, and thus they didn't want to make those tough decisions on March the 13th when it jumped over 10,000. And then it started to sustain itself at more than 10,000 cases per day, which meant that it was out there, that COVID-19 risk. And they were doing nothing to confirm it, and definitely not in a position to get the data they needed to move forward with treatment for those folks. All right. So one of the reasons why we were thrown off track, despite the fact that the schools did close in many states, was because of that information that said a child or a young adult is less likely. March 15th on the pulse check, there was 162,000 confirmed cases globally. And they were having that conversation about preventing the spread of COVID-19. By the end of that workday on March the 15th, there was 162,000. And I talked about what those increasing numbers look like. But today, let's keep it moving forward. March 17th, pulse check at about the same time when we were discussing that TED Talks and having watch parties about it so that we could be informed. There was 181,000 total confirmed cases on March 17th. 2,468 right here in the US that were total recovered. There was an increase of 9 countries, but we were still looking at numbers of around 8 to 9,000, just over 10,000 daily confirmed cases. Now that number we seem to want to dismiss, to take off the table, but that is people who could have just as easily been moved into the severe. That is those hospital stories that we can pull out, those elderly care facilities where not only were the patients getting it, but the people rendering care to them every day were also getting it. That is the story of those police officers out there, those authorities out there interacting with the public, but they were spreaders or potential spreaders of the coronavirus. That's what happened on March 17th. And if you get the Brother Moses Weekly Post, you could understand why that is vital information. And so what happened next? Well, as you'll see here, March 17th, by the end of that workday, that total number confirmed jumped up to 196,000 total confirmed cases, 80,000 total recovered. That's where we were on March the 17th. But after a sustained inability to contain the spread. See, now there was a storyline that came out that I had a question about. And it was on whether to bring life to a standstill. They're racing for this cure. Why is it important? Because the storyline is that you might not die from it, but you can have long-term reproductive health consequences. And the major storyline there was the introduction of our brother. On the U.S. Task Force. That is U.S. Surgeon General Jerome Adams. Jerome Adams. You see the brother sitting in the back there. Timestamp around, I think it's 1450. I'm going to play just a little bit of it in our watch party style. Give me 1 second to make sure this happens correctly. In order to play it, I know I need to do something with the music here. So I'm going to cut that music and let the beat build up at a later time after playing this stream. Now, before I do that, let me do this. Let me jump back into the StreamYard. I see we still got some folks rocking with us here, so I'm gonna keep the information. I'm gonna stop that screen share and then give another one salute. And then right now I'm gonna start the screen share, but this time I actually want to share audio from that screen. And so I got to click into that. Here we go here. And then we're going to jump into it and allow Jerome to say it in his own words, introducing U.S. Surgeon General Jerome Adams to those who may not know. So a pretty diverse force here, but I want to make sure we give our brother his shine due shine here. You don't make it this far in STEM to be forgotten by your own people. Nope. Not on the B1 watch.
As Surgeon General, whether it's opioids or cigarettes or the coronavirus, my job is to help the American people understand how to live a healthy life. And I'm asking all of you, I'm imploring all of you to help share my prescription for America to overcome this coronavirus situation that we're in. There are 3 parts to it. Number 1, know your risk. As you've heard many times, but it's still important to impress upon America, if you are immunocompromised, if you have chronic medical conditions, if you are over the age of 60, you are at higher risk. If you are a child or young adult, you are less likely to be impacted by the coronavirus. Number 2, the second part of the prescription, know your circumstances. Are you in an environment where you can telework? Are you planning on going to large gatherings like church? Do you live in a community that is being particularly impacted by the coronavirus? And you can find out this information from your state or local health department. Does your state have a hotline that you can call into to help you assess symptoms? Again, knowing your circumstances. And number 3, and this is the most important part, know what you can do to stay safe. And we have really leaned into coronavirus.gov. Please send people to that website. We've put...
That's a major key takeaway right there, that coronavirus.gov. And you'll see from the sources that I list and the ones that I continue to use in these live streams, they are directly from those ones that have been recommended from our authorities. So I'm going to continue to let him speak in his own words.
The tools on there for individual groups, specific audiences, so that people can understand how to stay safe. If we follow this prescription, we will overcome the coronavirus. As Dr. Fauci said, we will see more cases. Unfortunately, we are likely to see more deaths. We have not hit the peak of this epidemic quite yet, but if we follow this prescription, then we will decrease the number of people who are impacted. We will decrease the number of people who will die, and we will more quickly get to the end of this situation. Thank you.
Great job. Questions? Please.
Vice President, that poster right there, it says to avoid crowding, consider rearranging the large act.
All right. And so what you see there, U.S. Task Force update, that was March 10th, right? And so you saw a big spike hit on March 13th, 3 days later, and the media that started having conversations about this, that saying, oh, excuse me, let me make sure that I'm back on. One moment. Stop the screen share. And so you heard it there from our brother Jerome Adams, Dr. Jerome Adams, excuse me, and he is the U.S. Surgeon General of the nation's doctor. Now let me get back to my screen share without the audio. so we can keep the conversation rocking. And so we shall overcome the coronavirus being one of the major stories that he pushed out there. But you see, since then, we've kind of tweaked that messaging. Just like on March the 2nd, they were like, well, you don't need masks and regular people should not have masks. And we heard stories about people getting arrested even for having the masks on in public. Now today, we've seen that they've kind of tried to walk that back. And they've said, well, yes, everybody should have masks. And you see that as being a part of the ordinance or the mandate or the guidance that's been put out there. And so there's been a couple of things, even that the schools closing en masse was another thing that happened for a prolonged period of time, even though he said that young adults and, kids or whatever were not high or less likely to be high risk. And there was a couple of other different areas that we could always bring out. But I did want to make sure we're calling out that in his own words, you are at higher risk if, and then you are at lower risk. Also, we will overcome the coronavirus. We will overcome, or we shall overcome. Come on, brother. And then we will see more cases. Unfortunately, we are likely to see more deaths. We have not hit the peak of this epidemic quite yet. But if we follow this prescription being that language, that doctoral language. And so some people may ask, what does the Surgeon General do? To them, I also say, come on, brother. You saw the little fist pump right there. Stays in constant communication or liaises with the World Health Organization, one of those global entities that we do provide funding for to the tune of over $500 billion per year, if according to Donald Trump is right. And one of the things that they said when they declared it a global pandemic, which was even earlier than his presentation, was that there was a couple of things that needed to happen. Contact tracing, he called the backbone of the response. That was Dr. Tedros. And that essentially breaks down to when someone reports to a doctor that they don't feel well, what is the next steps for that doctor to take? And so what we saw there was that even at that time, they were saying more than 97% of people who contract SARS-CoV-2 show symptoms about 11.5 days after exposure. 97% have some type of symptom, and that's what they're calling about, that they are sick. Are you sick? If it's not the full-blown flu, which is what they started looking at, did you get that fever? Are they looking for a cough? What are those symptoms? But they're saying 11, almost 12 days after for some. Now, who was that impacting? That's why age discrimination matters, or why it comes into play. This is something that was put out there by the CDC, which is why we started having those questions even then. Bigger than the questions. It was based on an incubation period of 5 days on average was what they were originally looking at. That was something that was put out by the CDC at that time. And so we're going to hold them to that at the beginning of this outbreak for them, when they finally got the memo, they did not have the adequate data. And thus it links back to the inability to report. There was a wide variation of reporting that is still yet to be resolved. And so while they can jump into it, they can jump into the mass increase of supply, testing kits, ventilators, big ticket items, and even the littler items. But they're going to have to pull the trigger somewhere. This next slide here was really important. Like nearly everyone servicing healthcare, I am concerned about that coronavirus. I too await for more information from the U.S. Surgeon General Jerome Adams, because guidance from the CDC alone may not prevent the spread. So it's not just a guidance. It's not just a guidelines. It's not just a bulletin that ends up on the wall of your primary physician. More than that is going to be needed. And so the media tried to hop on board, but a significant portion of that media was saying it's exaggerated, it's insignificant, and they were guiding the conversation away from adequate reporting, even for those who may have had the capability. And so I think that rests with our light-skinned brother who kind of resembles Mario Van Peebles, but I do understand that brothers have to stick together. So I'm not going to throw him completely under the bus here, but I will have that conversation from this lens of a pulse check. I listed some of his awards there. I even said where I got the information about him as I was doing this big docs on the United States Surgeon General. This is a docs. But if you're going to docs at the highest level, and it'll be something that has some deeper relevance, like the number of testing kits that were actually made available and their ability to do so. And see, while they were looking at it from that lens, I jumped directly into a containment theory. And I looked at, using research, the different approaches to containment theory. Not just containing the virus, but in order to contain the virus, there is the containment that is a military science of containing people. And there's the that says looking at people from the lens of absolute criminals. Let me make sure that my camera is actually on when you see me saying this right here. All right, this is a big docs, and so I want to make sure that you have this content, but I don't want to overwhelm you too much. At the time of my presentation, I did play this cameo from Cameo just to keep the conversation light, but this is a big docs. I'm going to move right past Word Up. We can't get that one again. You would have had to see the original content for that one. I won't go back into it. But this post check is important. Why? Because Jerome did get his master's in 2000, his 2002 to 2003 internal medicine internship there at Indianapolis, and then 2003 to 2006 anesthesiology residency. He is the 5th Black person to hold the role United States Surgeon General. See, this is a big docs. UC Berkeley. I told you it was Sacramento, California, and right up the street there, you do have UC Berkeley. That University of California education system is a pipeline for our healthcare system. See, in the Black community, 75% of our doctors go to HBCUs, but in the other community, the one where there is American Medical Association influence, the ability and the authority to send a guidance letter to every doctor in your society, that type of authority, it comes from the top. And at that time, there was 162,000 global cases. You'll see there that we barely cracked. We weren't even in the top 5. It was mainland China, Italy, Iran, South Korea, Spain, Germany, France, then the United States with only 2,794 total confirmed cases. At that time, there was only 56 COVID-19 related deaths. Can I bring this information home for you? Or will it need somebody with bigger authority than Brother Moses? All we can do as media in a suppressed space where I can have 10 people watching, but this same conversation on someone else's channel that is not suppressed would have tens of thousands getting that notification and responding to get this information. But in a suppressed space, they will think that this WHO, World Health Organization information, this information informs John Hopkins. It was actually published by the source from John Hopkins. I'm just slowing it down and presenting it with conversation. And yet, the highest level of a docs would say, well, if you're going to challenge him, then what is the solution? I say the research speaks for itself. How to stop the spread of the coronavirus. This containment theory is a form of control theory proposed by Walter Reckless. See, in our society, it is reckless to continue to walk around and go by your day-to-day business as usual. That attitude is a threat to society, one that has persecution and prosecution hand in glove. Pun intended. GOAT level logic. The theory contends that a series of external social factors and internal qualities effectively insulate certain individuals from criminal involvement, even when ecological variables induce others to engage in crime. That is a heavy statement to make. That is heavy game for a featherweight. So let's break that down from Walter Reckless, or for Walter Reckless. The theory contends that a series of external social factors, that's because I'm Black, where external social factors can also mean by class. Because he is a doctor, he has the right to discriminate against me, the patient, or the Black man, or to just discriminate in general. particularly in situations like these, a global pandemic, and they have to choose the lesser of two evils, a life highly likely to survive or a life not entirely likely to survive, but in damn bad shape. And they have their last available ventilator, and they have to determine who do they give this ventilator to. See, that's a social factor based on class and internal qualities that effectively insulate that individual, them, and their behavior, which is discrimination. It insulates that certain individual from criminal involvement. They can't be prosecuted for it. No tort reform. They have to be protected in this space to make that decision. Even when ecological variables like the fact that I am sick too, hypothetically, that black elder is sick too. One of them is 65 years old. The other is 72 years old. And because you think that the 72-year-old is a higher risk of death, that ventilator decision may weigh a little bit in their favor. That 65-year-old, though, also has asthma and diabetes and is highly likely to survive if they get access to that ventilator for a few more hours. But that doctor has to decide who gets access to that last ventilator, just like we need ourselves to determine, do we want that oxygen? That oxygen, our life support, contingent upon artificial intelligence and machines. Now look at this theory from another lens, because it's talking about what would be considered criminal activity. In one case, the decision to let die could be a criminal activity. I'll give you a scenario when. Let's say, hypothetically, there was someone who was, drowning, and they had been rescued from the condition of drowning, but now that lifeguard, puns are intended, GOAT level logic, that lifeguard is going to have to ask themselves, can they resuscitate? And it is a vital skill for them to have the ability to perform that life-saving skill on the person who was in a condition of drowning. And now it doesn't sound like they're breathing. And that decision is to resuscitate or not. That lifeguard, or the appointed authority in that situation, has a duty then. One that says, if I start to attempt to resuscitate, I am responsible for then continuing the resuscitation efforts. But they have a decision. They have choice in that matter, which is, and if I don't, then I am not liable. I'm not obligated to continue trying to resuscitate. There are people who will watch the activity happen and not feel that humane duty to attempt to resuscitate. They would sit there and say, but if I try to save this life and I get it wrong, I may be prosecuted. And there are people sitting inside of a queue to be called back, and they are awaiting a more strong, urgent, pressing need to make that dial, to call that person who 2 weeks ago, they said, I'm feeling sick. And all they can do now is just follow up and pray that that person on the other end of that line, that person who at the time they called, they left a message and the doctor was not available. And so they left a message, and now somebody on that team has to call them and say, we did receive your message. How are you doing today? And in this storyline, there is under-resourced communities that cannot give that call back to our elders. And it is a racial thing that is our duty to bring it on home. And so those individuals are written off and dismissed. And they're written off because of this idea that they could be criminals. These are just poor black folks. These are just poor people. These are people on Obamacare. These are people who don't even have health insurance or fully adequate health insurance. These are people who have made bad decisions and did not have preventive health screenings for the last some odd years. These are people that don't even have a primary physician, people who may have just tried to go through the emergency room and been turned away via a health screening and didn't even get a test. They just got the health screening and sent home. And these are people that look just like my elders. As you see, this containment theory originated with Walter Reckless in 1940s to the 1960s. Maybe you can't see it. I will make it a little bit bigger. And when I'm thinking the 1940s through the 1960s, I am on topic because I'm talking about my elders, 1940s to the 1960s. And I hope you catch that. Now, we know that there are other ecological variables, and we also know that when it comes to the engaging in crime, such as those stories that they'll bring out of people who are being locked up because they're stealing medical supplies. And we also hear stories about those American Red Cross chapters that have hoarded just enough supplies just in case. But I'm going to give you not just one solution, I'll give you another one. This, how to stop the spread of the coronavirus, deals with the neutralization theory, which was developed as a means for explaining how criminal offenders engage in rule-breaking activity while negating their culpability or blame. This is what B1 Network already knows. This is a pro-Black sentiment all day, every day, is that criminal offenders, that is, and in this case, think about it from the lens of a white doctor or white collar crime who is engaging in rule-breaking activity, i.e. they're not even reporting these African Americans who called in. They're not even checking those voicemail messages and calling them back. But these African Americans who did leave a message and haven't been reached out to, no contact tracing. Those doctors who are engaging in rule-breaking activity, they are simultaneously negating their culpability or their blame. They're saying, can you blame me? I don't have the resources to even call these folks back. They can say, look, I had over 300 calls came in and I did not have a single test kit. And now they can say at the local level, we still don't have test kits. They can say, look, I lost staff or the ability to pay staff. And I did not receive a government bailout or a stimulus check that allowed me to retain that staff to make those phone calls. They can negate their culpability. They can write it off on taxes or write off people's lives or the decision that they made. They can just negate their culpability. And so we look at that as a theory, not as one that says, look at the individual doctor, but as a theory of, well, I'm engaged in this rule-breaking activity because type of behaviors. Now, let me bring in some more music at that point. The last track that we're listening to, Spanish Trench, speaks right there. It's this ability to discriminate based on whatever the factor is, and then negate your culpability or your blame due to the circumstances, all right? And so one way that they do that is by making the conversation about people of color and not having it about African Americans. They'll say, well, people of color, or they'll say, look, this is a broader thing that many experience, not based on race. They'll say geographically, we have some challenges with that storyline you just gave us. They'll say locally, we have some issues. They'll say that is a state issue where we have those issues. They'll say logistically, it was a nightmare, that it was cost prohibitive. So they've made it about economics. See, those are the different ways that they can move that conversation or move that goalpost, that they can deflect from it being a decision made to discriminate against an African-American man, woman, elder, child, to dismiss them as being less risk, to make that categorical decision and then therefore not have the data resources or the capability to do what needed to be done. All right. And so because of that, wait, I got one more. I said 3, right? That is the neutralization theory. I don't want to change and add music just yet. I want to tell you about this theory. Therefore, you don't think that it's B1 Brother Moses talking. Sometimes we got to speak to that white man inside of even our educated heads. This time frame, I told you, between the 40s and 60s, when they were looking at these theories that actually speak to the heart of the matter, which is criminalization and what that does when you discriminate against someone. In your head, you have to qualify people. And so there in 1957, criminologists Gresham Sykes and David Matza, who contended that juvenile delinquents know the difference. See, they know what they're doing. That's what they said about the kids in their study. They were looking at the juvenile delinquency and criminality amongst kids and asking themselves, well, why do kids continue to do things like they'll go outside and come back in the house without washing their hands? No, more serious. Why do they engage in things like theft and bullying and cyberbullying and things? And they want to look at juvenile delinquents and where are they missing the mark on what, and they say they know what they're doing. And at some point, this theory that was introduced expanded to all criminals. And then by default, B1 GOAT level logic, then all criminal actions or behaviors, even to the point of discrimination on someone's life. That was neutralization, but then I also give you this final one. Containment is best known as a Cold War foreign policy of the United States and its allies to prevent the spread of communism. So in here, instead of coronavirus, look at communism. And now you still have those deeper ramifications about China that allow the tin hats to say, damn, that brother is bringing information. And then you also have the context that this was after the end of World War II. And I told you it's from the 40s to about the 60s that we're examining, and the discrimination or the race-based discrimination, social and economic discrimination, and the impact and its correlation with health disparities. All right. And so all of that is within this one presentation where containment represented a middle ground position. And see, that's how they negate it. All right. That middle ground position of detente, relaxation of relations, and rollback, the actively replacing. So do you take an active role in the decision? Or do you just stay hands-free and it wasn't me and therefore I am not responsible? See, that's 3 correlated topics, 3 ways of coronavirus of viewing, or 3 different, perspectives, right? Theories, that is, that are relevant to this topic and the decision that needs to be made. So with that, I've given you those 3. And what I want to do is, do I want to pivot here? Nah, we're not ready for no pivot. We're going to keep that information going. That was a little bit dark. And so I'm going to jump equally as dark to the end, Nard and B. And this will be our complement for the next section, our accompaniment or accoutrement. Give me 1 second. We do want to keep that information rocking, so continue to rock with us, and I salute you if you're rocking with us here today. But this is a pulse check, and I got to know that people are still rocking and not deflected. They're not distracted so much that they forget this is a big docs. Not a play docs, but a big docs. When you're asking questions like, should companies approve additional paid sick leave to prevent the spread of coronavirus? And that's what we needed at the time. And what you've seen since, what is the numbers today? I know it's more than 10 million total claims filed for unemployment. That's what actually happened because we could not get an affirmative answer to the question we put on the table, which is the approval of additional paid sick leave to prevent the spread of coronavirus. And those folks had to be flat out fired because our federal government could not cut the check to even the businesses in time, let alone to those people directly impacted by being fired. And the healthcare ramifications are deep and they are real, and they are striking us again on along racial lines. Feel me? And I'm not going to be the only one to call that out. But this is a pulse check. a big dox, including the email address of said victim of said dox. Dr. Jerome Adams, the 20th Surgeon General of the United States, his mission as the nation's doctor is to advocate the health of the American people. Dr. Adams' motto as Surgeon General is better health through better partnerships. He is committed to strengthening relationships with all members of the health community and forging new partnerships with members from the business, faith, education, and public safety and national security communities. To submit a request, there is a live link available, but his email address, sginvitations@hhs.gov. These are the people they put on the website and said, reach out to me. And if you are an African American, they also have a link there that I would encourage. One, that if you feel you have been racially discriminated against by a healthcare provider, there is a link there to file your claim. I don't know how big your story is. I don't know how small your story is, but you may have a story, or you may have a grievance, or you may have a claim to file, and that will be up to you. So, coronavirus update request. We were looking at the word concerned. Excuse me. Should companies approve additional paid sick leave to include those who self-quarantine to prevent the spread of coronavirus? So what happened in our story? What happened is there was an individual who tried to call, and they went to the doctor's voicemail, and that doctor did not have the ability to return that call. And then there were individuals who actually did get to speak with their primary physician. But the only information that that primary physician could impart via telehealth services was to stay home and self-quarantine. Around this same time, there was guidance issued. There was a categorization that happened. A categorization that said there are essential and then there are non-essential workers. There are essential and there are non-essential businesses. I'm going to change up right there. In my slide, you see an effective date as soon as March 16th, which means that this content was created even before the spike really started running and becoming a prolonged, sustained increase of about 10,000 confirmed coronavirus cases every day. And that number kept going up, and he predicted it. He said it correctly, that we have not yet reached our peak. And so they knew that it was happening, and they knew tough decisions were having to be made. But what happened? Millions were laid off despite knowing it, and despite even having approved a federal budget, a stimulus bill, despite having it move from the Senate back to the House, from the House to the Senate, getting shut down, approved at the House, Senate shuts it down. Senate then says, let's make it more. They make it more, and then send it back to the House, approve it, send it back to the House. Nearly unanimous approval for the stimulus bill gets approved from the House. President signs it, and still not to be able to cut that check. It ought to hurt you, because when you look at the data, you see what happens even after that. And that data is significant, which is why I've been just taking my screenshots here, or taking their screenshots to say it, all rights reserved to those who created this screenshot that I put on the screen that's coming up next. Stop the music.
So 100 minus 35 minus 35 minus 8. No, okay, 200.
All right, my friends, this last update here,
Oh, yeah, because you're adding the shield.
which is again back at the beginning, gave you the background from December 31st all the way forward through March,
Oh, man. No.
showed you where the numbers were then. And now I want to show you one more time where the numbers are today. And I say that the government is complicit. It is my story when it comes to race-based and these tough decisions. But this information here comes from Johns Hopkins. There's the Institute of Health Metrics and Evaluation that's there. This was 4/8 that you see on your screen. We can see the total deaths and how that is spiked. We already know America there, where those numbers went. You'll see this chart here that shows you that once he said we are not at our peak, we see just how far off we were from being at our peak, that number jumped up to more than 100,000 confirmed positive cases in April. And that was a day. Now, these are global numbers, but we know that information does break all the way down to by state. We know what happened, and we know that the media is also complicit because they were spreading a narrative that it was exaggerated. The risks are exaggerated, and thus it went around 10,000 per day, less before, to 100,000 in a day. And we still don't have the capabilities to go to the country. There's countries like South Africa that only have 24 positive confirmed deaths related to COVID-19. You feel me? 1.5 numbers vary by source. They vary by country. They vary because of reporting capabilities. And even because we still deal with this question. This is a question of conscious of your own morality. Do you have a duty to report? Do the doctors have a duty to file that report on your behalf? So to show you that this information is current, I'm going to hit the refresh button for you right here on your screen and show you again here, Johns Hopkins University in Medicine Coronavirus Resource Center, total confirmed by the end of this presentation now has moved to 1,696,000 global cases. Don't forget the 139. There in the United States or here in the United States, 500,000, number one on the list of total confirmed cases. That information goes out as, well, it's because we have increased our ability to test. For me, I tell you that is also because there are that many more people who are positively carrying the coronavirus. They have it. And thus the risk is still unknown. It's got to be alarming, at least in the minimum, to look and see where the United States was March 13th, as I've presented, and then see where the United States is April 10th. 1 month of data. Still a few days short, but 1 month of data. 28,000 recovered cases here in America. 28,000, that's a big number and that's important. But don't forget that this is what they're talking about, flattening the curve. 10,000, 6,000, 9,000. This is the daily number of positive confirmed cases. Now, if you ask me, I wouldn't mind seeing this number more actual. Personally, I wouldn't mind that test, depending on its implementation mechanism. I'll say that. But if it's like an app on my phone, kind of like how you can unlock an Apple phone with your thumbprint and then that takes your temperature or whatever, if it's something that smart, like a smart app, and I'm just using my thumbprint to actually test for it, and whatever it is that they have in those little smart gadgets and gadgets, then by all means, I wouldn't mind, I wouldn't mind doing that. And then the other mechanisms, like I've heard they had the nose swab or something like that, to where it's just a Q-tip. And if I'm using a Q-tip and then whatever comes out of my Q-tip, I just put in a little Ziploc baggie or something and put that in a jar or whatever and then send that, then I don't think that's too invasive of a test kit right there. I don't think that would violate my civil rights to the point where I would want to file a claim. I wouldn't want to say that my civil rights have been infringed upon in that instance. But if it was forced upon me and someone said, now you have to put this swab up your nose, now I can see where that kind of iffy and kind of makes it seem like civil rights have been violated, and thus I might be one of those people who go to that website and file that claim, that coronavirus.gov. All right, so a couple of more major driving points here, and then I'll conclude. All of that background story about Jerome. Jerome's in the house, my guy. And I'm going to give you the punchline here. Watching the Watchers, B1 Network, salute. We are finding similarities to our story, includes the marginalization of our elderly patients, deprioritized based on their age and level of disability. Other reasons notwithstanding, list non-inclusive, non-exhaustive. Now, it is being justified as, the doctors, we had to manage the patient flow. And as that patient flow intensifies. Now, when I look at that information, I see that we have a serious situation that is challenging big U, big S. It's challenging us. And that is a situation that begs the question, how and when is discrimination mandatory? Now, I wanted to play around with that word there, mandatory, because how and when is discrimination necessary is another way that I can say it. Sometimes discrimination is necessary, life and death, choosing between the greater of two evils, all concepts that have religious and, all of those different themes interwoven throughout. It's meant to be a triggering statement. This discrimination, this race-based discrimination, I took the race-based off and just left it at discrimination because in this case, we're talking about health disparity. And so we're talking about the decision on who gets the healthcare resource or the healthcare time, who gets access, who gets that call back. There's a lot. But in that same sense, we're asking a tough question here. How and when is discrimination mandatory? I use the word mandatory because in my line of information giving, I give you the premise that I have. My bias is that the government is complicit. And so mandatory meaning, or the moving of that word to meaning mandated, where there is an authority telling them to do so. And so they have now this excuse or this deflection, this justification for criminal discrimination. They have a mandate that tells them, yes, not only is it necessary to discriminate in this case, but it is mandatory, where they tell the doctor to choose the individual who's more likely to survive and give that individual, based off, their whatever insight, their professional opinion, give that individual access to resources. What are they doing? They are denying that other individual their rights to live. They are denying that other individual their fair access or their equal access. They are given this mandate, thus allowing them to deny one of our elders. And for that, there is a claim that has to be filed by those individuals. Now, protections are typically extended by federal policy, but they can be overridden for humanitarian reasons. See, I'm going to put facts right here instead of the emotion. Protections extended by federal policy can be overridden for humanitarian reasons. In this case, we're talking about a pandemic. Secondly, high risk can become subjective during a national emergency. In this case, there was a global declaration of an emergency, but in this case, again, the pandemic. And the same way, woo, I almost wanted to turn the music back on with that one. But the same way that they can provide blanket protection for the nation's doctors who have to make tough decisions, that's the protection that we want. I'm going to let that sink. The nation's doctors have tough decisions to make. And God protect them. The Hippocratic Oath cannot protect them. Given the circumstances, I'd say the race of the person, the age-old race card, of course, as well as the birth year, shouldn't disqualify treatment. But given the circumstances, I can understand how a doctor would make that decision. And I can also understand how an authority should make that tough decision. However, race-based. If we're on the losing end of the stick, we can't advocate for it. We would have to advocate against it. We can get there. But first, here on the screen, again, the reminder. Is there a risk of reproductive tissue damage due to the coronavirus? I looked at the source that was recommended by the U.S. Surgeon General, which is www.coronavirus.gov. And as of April 10th, 2020, here's what I found when I looked at that website. And it was talking about some of the things that you should actually contact your medical provider for. And it said, if you developed emergency warning signs for COVID-19, get medical attention immediately. And it listed some of the signs that one should look for. The third bullet, which is why I put it right underneath that box, is new confusion or inability to arouse. That one's heavy. And that is something that we would need long-term protection or healthcare access for. And that is something that shouldn't wait to develop, whatever it is, to get it on the books and to say, hey, this is something that it concerns me. Reproductive health. And now I know that they did have some conversations on that U.S. task force, which was talking about the waiver of copays and things like that the doctor can do in this event. But key takeaway would be having that conversation. Now, I'm going to give you another perspective here. Now, this is my inquisitive side here. This is an opinion piece. Coronavirus Resource Center data shows gaps in reporting capability by country and the United States and cities. All right. Sorry, I bungled that a little bit. But understand what we're dealing with here. This is created by me, B1 Brother Moses, and it's a bit of a survey style, just pretty brief though. Are healthcare providers compelled to report every concern every time? Say it again. Are healthcare providers compelled? That's that mandatory thing again, right? Are they compelled to report every concern? When I'm saying every concern, I'm talking about those who called in, they went to voicemail, they got in, they did telehealth services. Now, when I'm saying report, I'm saying from the doctor to the CDC, from the doctor to a higher authority, to the AMA. And if they're compelled to report, then to whom? And what are they reporting? The individual name, all of that now is going right at HIPAA. Understand? Privacy. And so I'm saying the protections that were extended by policy like HIPAA can be overridden for humanitarian reasons. Example, when you move the word pandemic, like I said earlier, replace that with privacy and the duty to report. And then you'd ask that question, you would say, yes, in a time of a global pandemic, every healthcare provider should compel to report every concern. And so it goes to the second question. Have they been doing so since, say, March 13th? And as you saw, March 13th, we started getting 10,000 cases of confirmed, which meant that something was happening. Somebody was getting tested. In our defense, we want to make sure that if that information, that concern was raised by African Americans, are we doing our part to raise our concern levels? Get that information there. And if that information was concerned about our elders, was it even reported? Here we're coming upon 1 month. Has it been reported yet? And see, now these are hard driving questions. Question 3 has how many different parts? 1, 2, 3, 4, 5, 6, 7, 8 different parts to look at here. With 8 different parts, you got to understand why I need music. And so because of that, I'm going to give you some time to recoup, get yourself back right as I find the next track for us to drive through. I'm going to give you Caesar right here, Nard and B. Caesar's one of my favorites, so I'm going to give you even more background noise. Question 3A through H. How many of our elders raised sickness concerns with a healthcare provider? And question A, we don't even know what happened to them. What happened to our elders who actually called a doctor and there was nothing they can do? What happened to our elders that didn't know who they should call? They didn't have a primary care physician, so they called someone, but it wasn't the doctor. Maybe they used the internet and then they tried to submit a claim there. They got a chat box or something, but they reached out to someone in the healthcare ecosystem. Say it with big words that they like. They reached out to someone in the healthcare ecosystem and they got what Brother O'Shea Duke Jackson would call no response. And we don't know what happened to them. I won't linger. Question 3B. How many of our elders raised sickness concerns with a healthcare provider and then they felt symptoms for a while, but never isolated themselves despite the warning? See, I got to put that out there because there are those who would want to say, well, it's personal accountability. Personal accountability. It's up to that individual to reach back out if they got sicker, or if they got sicker, did they go to a doctor? No, we're not there yet. We just want the accurate data to be able to give this its full merit. Give this coronavirus its full chance in hell. Or our response, its fullest capability, right? We don't want our communities to continue to be underserved. And now that they're cutting big docs numbers, big documents, they are producing big $1 trillion documents. And we can still not get access to that capital in our communities if we're just silent about this. I won't linger. Question 3C. How many of our elders raised sickness concerns with a healthcare provider and left a message, but they never spoke with their doctor? Why is that important? Because at least have a voicemail or an email and you can track all of those and say, wow, we have at least contact tracing that can happen before you cut off funding for the World Health Organization. Before you say we're not going to give you funding, did you follow up on what they told you was the backbone of our recovery or response effort, which was the contact tracing? You were contacted. Were you able to trace it back and follow up? If your answer is no, you don't even know how many messages were left. You don't even know how many folks reached out and spoke with their doctor or never spoke with their doctor. Then you can't give us accurate data. You can't tell us how it impacts our elders with diabetes. You can't tell us how many of those who have lupus it impacts. You can't do no number crunching. And therefore, your vaccination will mean absolutely shit to us. It may work for a 90-year-old white woman with no pre-existing health conditions, but how will it respond to a body that has its fair share of existing health conditions? How will it respond? That antibody that you're trying to extract and then reinsert in someone else. How will it respond? That person who is now considered total confirmed recovered, and their blood sample and the data that is rich data for the hundreds of thousands now of recovered cases, how will that rich data impact the Black folks who are disproportionately dying? And now that they're dying, it's a bit late to try to say, well, let's look at the data if you were never collecting it in the first place. And if discrimination was just something that could happen because you were under-resourced, and these underprivileged and disadvantaged minority group can now just become a part of a bigger people of color set of data. Not Black folks, but a bigger people of color. And there are diverse groups like homeless people who we can also look at. No, I'm talking specifically about us and our elders. 1940s to the 1960s, we know at the very minimum they ask those folks on their screening, what year were you born? So I'm not asking for all the data, but can you at least produce the data for that subgroup? And if your answer is no, and if your answer is no because of discriminatory practices, there is a claim to be filed. Excuse me, I don't want to linger, but let's move to question 3D. How many of our elders raise sickness concerns with a healthcare provider and leverage telehealth services only? Those telehealth services, going by their mandate, then determine that they should voluntarily isolate. That is a challenge for the African American on average because the households, number one, do they own a home? Less than 50%. The data does not support it. Number two, the size of the African American elder's home. Is it a space that has multiple bathrooms or a place where they can isolate themselves from the rest of their family? On average, when we look at the data, it is not confirmed that they have the ability to effectively voluntarily isolate themselves, not in their own homes. So if your only solution at that time was for that person with personal accountability to voluntarily isolate, and there was only that telehealth service provided, it is an inadequate response by our government and also by those who are a part of our healthcare system, ecosystem. Excuse me. Question 3E, because I don't want to linger. How many of our elders raise sickness concerns with a healthcare provider and violated their voluntary isolation recommendation? Why is this important? Again, we still have to placate to that damn Black conservative who will advocate for personal accountability. And so we want their number 2, so therefore they're included in the conversation. We don't want to omit any data sets. We want all the data and we want all the smoke. Those individuals who violated their voluntary isolation recommendation, was it because they lived in an apartment? Was it because they had bills to pay and that stimulus check was not going to get there on time? Did they need tissue? And I'm going to break decorum and do the most unprofessional thing and eat my potato chip. That is a damn good chip. But I'm not going to linger. See, it's like for me to have a chip on my shoulder. I'm Black. I live in a perpetual state of anger. And it's not always about, in this case, it's about age discrimination. And it's also about class, geographical barriers that prevent our elders from having equal and fair access to that healthcare ecosystem that is better equipped to deal with their state of emergency. Question 3, F. You can't even have Caesar again, but understand that that was Caesar. And if you're looking for more of that, that's Nard and B, man. We got to ask our people to continue to be fearless in the face of adversity. Don't be no fool, man. That chip was so good. I got to get one more. Because it is all right for me to have a chip on my shoulder. I'm a black man. How many of our elders raised sickness concerns with a healthcare provider and have not, oh, excuse me. F is actually, they have been tested at the doctor's recommendation. See, that is a number that we can actually grab. And I think that is one that's actually being considered. The last I checked, they were actually considering whether or not they report negative cases. I'm asking them to expand on that, not just negative cases, but for the purpose of contact tracing, you got to be able to follow up later. That person may follow up later. That person may call in, and based off the information we have, 14 days later, now it's more critical or more dire that they get the attention of a doctor. And it needs to be on record that they did call in 14 days ago with some symptoms or at least some concerns. So this one says that those elders have actually been tested. I think it's good information to have. How many of our African American elders born between 1940 and the 1960s have actually been tested at the doctor's recommendation? That is an important number to have. Is it 1% of our elders? Is it 10% of our elders? What number are we actually asking for? Now, we're not saying, I'm not somebody who's saying test every American. But that will not prevent me from asking how many of our elders have you already tested? How many of our elders have actually received their test? See, this is somebody who raised concerns with a healthcare provider. They voluntarily reported themselves. And were they afforded the fair and equal access to that healthcare system, one that is being constrained by a global pandemic, one that has mandates and authorities coming from the highest levels, not just in our government, but from a global healthcare ecosystem? And see, some would just dismiss it as being, oh, he's being racist, and not get the underlying premise that I'm trying to deliver on here today. And so I'll go to question 3, G. How many of our elders raised sickness concerns with a healthcare provider and were contact traced and tested? And see, now this is a good one if you have a hat on like myself. You do want to know whether or not they are actually contact tracing. Who is your family members? Kind of like that Facebook, that open friends list, because that individual, that African-American elder went in and got tested, they are now mandated to open up their friends list. Or at the very minimum, anyone they've come in contact with. Now understand this, come in contact with also means the exchange of goods if you're dealing with products that were able to be shipped in the amount of time that their coronavirus was still traceable on those packages. Not just that, but those members were actually passing out things such as gifts, gift cards. And so that network is broad. It's a complex algorithm to create, and it's definitely a costly endeavor to implement contact tracing. But it was declared as the backbone, and it's going to stand right on our constitutional rights. And it's going to make situations even harder morally, constitutionally, HIPAA-wise, policy-wise, everything-wise, even personally. Because now even my own conscience, I have to wrestle with that. If a person knows that simply by reporting to a medical healthcare provider, that they're not feeling well, if that then means that their entire friends list is now open and available, everybody that they came in contact with now has to get a phone call. If that's what it is, I got to ask myself, do I have a duty to report that cough, that sneeze, that constant headache, that pressure, or to be as concise as possible, do I have a duty to report that concern? How about this one? Just like that bystander that was observing that person who was in a condition of drowning, and that bystander was watching on, maybe even recording for World Star, someone else try to be that lifeguard or save that person using life-saving skills and techniques. That bystander is still applicable to our neighborhoods. If you were concerned that someone, let's say on your Facebook list, friends list, was sick, or someone you were having a FaceTime or a chat with, a conversation with, if you were concerned about their welfare, would you feel compelled to report? Do you even have a system yourself of being able to contact trace your own touch points with people? I don't think so. There's reporting capabilities. There's a gap in reporting capability. And it's also in the consciousness of each individual. And finally, question 3H. We need all of these. I'm not asking for individual. I want all of that data. And as you see, it's a different data set that we're asking for. Now, H, how many of our elders raised sickness concerns with a healthcare provider and passed away and were tested posthumously after they died? How many of our elders were actually tested? How many of our elders who were born between the 1940s and the 60s have passed away since March 13th? And their bodies were actually tested, or their blood was tested for the coronavirus. How many? Now, I would say if they don't have the data to prove this, then they do not have the data that they necessarily need to defend themselves against racial profiling or racial discrimination. But at the same time, me being somebody that's astute, I also know that the United States Supreme Court recently ruled the but-for clause, and they ruled against it, or they declined against it. I think this is a different case altogether. This is more of the actions of individuals who would then say, I think I've been racially discriminated against in the healthcare ecosystem, and here's my story, and for them to take the action of actually filing the claim on the website that was mentioned by our brother, as well as by that Health and Human Services director. Last one is no question. Quick recap there. The Coronavirus Resource Center data shows gap in reporting capability by country and U.S. state and city. Question that we're asking: are healthcare providers compelled to report every concern every time? We can expand that to also include citizens. Are citizens compelled to report every concern every time? If you are concerned, are you compelled to report that? Just like for our providers, are they compelled to report every concern? Finally, the data request. Have reports been made since March 13th? We're looking at all of those reports, and I gave A through H of different data reporting that we would want for the African American. We want our data, the actual numbers. You can't just tell us this many people died. Show us how many people tried. That's what I'm asking for here. How many of our elders, and I'm just getting one subset. If they can't provide the one subset, then it's definitely unrealistic or unreasonable for us to assume that they can go the step further, which is give us all the data. But in any event, how many of our elders raise sickness concerns with a healthcare provider? And that is A through H, where it's just a big question mark today. And if that's going to continue to be a question mark, then that's going to continue to be something that we have to be vigilant about. That is up to us to address. So let's say, given the circumstances, we should all understand how and when a decision maker should choose the lesser of two evils. The combined efforts of the National Baptist Convention, the Office of Civil Rights, the ACLU, the NAACP Legal Defense Team, the AMA, and the CDC cannot force a doctor's hand today. They can't make the decision for that doctor which suffering patient gets the only available ventilator for a few more hours, and they can't make that decision for the doctor to choose which of those patients does not get it. And we're talking about the worst case scenario here, where doctors are choosing the highest likely to survive, and where doctors are considering whether or not they should discriminate in order to save that life. And we're talking specifically about the discrimination against the African American. And in case I drove it all the way down by saying the African American elder, born between 1940s and the 1960s. Now, our preferred choice, again, would be surplus, which requires our collective urgent care. Now, I'd vote to approve damn near every stimulus bill that comes across their desk that our legal politicians or authorities, whoever it is, I would say all of them that come across the desk. I would say up to $100 trillion. Up to $100 trillion. Just to be on the safe side, pun intended. And I would say that that is urgently needed by Big U, Big S today, by all of us. And of course, I'd say that approving every stimulus bill that they can write includes our reparations. Go on and write that in. I would be in favor of approving all of them. And more specifically, today, the lack of available resources and how that adversely impacts the least of these, which is what they consider to be our elders. The story here is that HIPAA is significantly weakened against the coronavirus, and the CDC guidelines alone will not stop the spread of the coronavirus. That we do not want our people to receive subpar care based on race or class, and yet we still lack the economic and political authority to ensure access to fair and quality health care for our own elders. That's a challenge. That's a problem. We don't even got the authority. We have departments that are responsible for overseeing those things, but we don't have authority. We have a brother in office, a light-skinned brother who looks like Michael Eric Dyson. To me, anyway. and he is the United States Surgeon General. We have a brother, but we still don't have authority. There are two things that we can learn from this report here that I'm going to be ending on. Number one is the actual big docs was not just our brother. He's not the one with the authority. The actual big docs is Roger Severino, the director of the Office of Civil Rights there at the United States Department of Health and Human Services. Roger Severino is the actual big doc, the director of the Office of Civil Rights. That person advises us to use or to visit their website, which has a link if there are more complaints to be filed. That's the big docs. That is the civil rights reparations case. Where do I submit my claim of racial discrimination in the healthcare for healthcare disparities? It would keep flying over people's heads, but I'm going to say it one more time. The biggest docs that can happen is spreading the message about that website for African Americans who may feel like their civil rights have been violated somewhere in the healthcare ecosystem. And I've given 1-2 hour presentation that hopefully drives that home. But just in case it doesn't, I've provided a few keywords. Office for Civil Rights, United States Department of Health and Human Services, State of Alabama. Those are your three, your keywords right there if you want more information. Now, if that isn't enough, I'm going to give you what I hate to give you, which is just the basic hashtags. Hashtag OCR, hashtag HHS, and hashtag SARS-CoV-2. And then finally, I will give you an executive summary to make this shit work. All right? So the story was the HHS reports COVID-19 related civil rights violations in Alabama. Alabama shouldn't be the only one that has civil rights violations being reported. First and foremost, Alabama is not the only state where we should have civil rights violations being reported. First and foremost. And if that's the only state that has civil rights violations being reported, then we aren't doing shit as Black media. We aren't doing shit as users of media in general. What should we expect going forward? More of our Black health advocates who are a part of this healthcare ecosystem to leverage these tools and the resources they have available to enable a greater access for all our elders. See what I did right there? I used their type of tactic right back in this stream. I just hour, and you know who I'm talking about, but it's the language they would need, so I'll say it again. Going forward, we should expect our Black advocates. It could be white people who are Black health advocates today. I don't care. It could be Jews. It could be the people of color. We need Black health advocates who will continue to leverage the tools and resources available that enable greater access for all our. That's the language they need right there. The executive summary. OCR resolves discriminatory ventilator triaging guidelines with a review. What you see on your screen is just one state, that's South Africa. That is South Africa. I've been there at least one time. And I thought it was important because I come from Sacramento, California, very beginnings. But to actually go to South Africa was life-changing. It's impactful. It's Pan-African best. But what I found to be most interesting, or what I was that there are some similarities that are across the board. And on this particular case, I wanted to be clear here. Our issue is a diverse issue. So it is 100% expected for us to address our issues during the global pandemic. All right. Again, we are looking at Johns Hopkins data and breaking it down. Some people can only get right here, which is that 10,000 a day. And they think that the conversation stops here at March the 13th. But as you'll see, those numbers continue to climb and climb. They pass 50,000 in a single day, March 24th. Move past 60,000 the next day, and they haven't come down since March 24th, except for a couple of days here. But even when they came down, it was still on average around 60,000 per day, global confirmations. And I want you to have the real data. Now that they can show us that they have this data in this broad context, I request the data for us. It's ours. Stop the music. We have 15 minutes remaining in this live stream. And so I'll just bring you over some of those sources as I close. Johns Hopkins University and Medicine. I'll give you a good one here. Since this is the Center for System Science and Engineering, and people like to say STEM, 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 and STEM to the rescue. This source here is leading the world. And don't take that phrase lightly. They are actually leading the world using their data. And the decisions that are made are really important right now. They are connecting the world, which means they're using an interactive map that is on a global scale. We have to think globally. More than 40 million of us, we are as large, if not greater than, many countries. And when you're looking at data that can show you 24 cases in Sacramento, a smaller city by many standards, and then above them, South Africa, 24, you know that there's something wrong with the data. There's something wrong with reporting. And then if you continue to have that conversation and go all the way deep on your research, some of these conclusions that I've been at, which is that there are many African countries that have opted against testing and that are very undersupplied right now and couldn't test if they wanted to. And to have access to those systems to be able to test would still mean that they have to have the moral fortitude or the political system to implement a testing. And that's not just places in Africa. There are places where African Americans are still weighing that same challenge, where do they have access and fair and equal access to a test, even if they wanted to? And we cannot affirm or deny that access being fair unless these people, the authorities, the leaders, provide us our data. Long-winded, but you'll see there that they have a wide range of topics. I just gave the one here, testing and such. Let's see what's next. I liked this one. This one here, I actually loved because of this picture. This is the driving home of it, a respiratory disease. but actually this, I got the information, my source for background, as you see here. It was a screenshot, but I didn't want to overwhelm. All right. The next source here, this is just the sources cited section. I love the fact that they had a buy me a coffee right here at the top of their website. But AV Schiffman, salute. You can follow them on Twitter if you want this dashboard, which actually breaks down so much better, right? So you could look at the United States, for example, and start seeing it by city. You can see the total. Let me actually refresh so you don't think that I'm on some bullshit. We're up to 1.7 million. And then in the US, I'll do just a quick highlight here. This is the top right corner, and this is by city. So I'll just give the quick top 10. New York with 172,000 confirmed cases. New Jersey, 54. Michigan, 22. California, 21. Massachusetts, 20,900. Pennsylvania, 20,000. Louisiana, 19,000. Then there's Florida at 17,900. Also Illinois at 17,000. And then Texas at 12,000. Georgia, 11,000. Connecticut, 10,000. Now, Washington is at 10,000 as well. Maryland at 6,900. I know for a fact still experiencing some reporting issues. I know for a fact. And so because of that, you see here this number recovered 6%. That's going to be hard to judge. Just like, again, they have the fatality rate at 4%. That is still going to be contingent upon the number of people who have actually tested positive, which means they got to at least test. And if they haven't, then you don't know. This red column here shows the number that's decreased, but changes today was another big number in this data set. I actually like it. There you see the total of 2,000 is the increase in changes today in the number deceased. The total number deceased being around 18,000 or almost 20,000 here in America. I remember when there was only 2,000 confirmed. Now we're at around 20,000 deaths. And just under a month. All right. Now, again, Fox News to the tune of 79% was saying, look, this is over exaggerated or not as significant making it out to be. I think that the media is also complicit because the key decision makers, even though 75% of the nation's black doctors or dentists come from HBCUs, we know that doctors that are they're typically not in this healthcare ecosystem that we're dealing with. That is not black folks. The overwhelming majority of doctors here in America who are discriminating or who are what would you call them? The plaintiffs. If you wanted to look at it from a collective, the AMA or whatever it is, however you would want to break it down and say, look, they were complicit in the discrimination of African Americans. They had a duty to report, but they failed to report those African Americans who came in. That's what you're trying to get to. You're trying to get them to actually give you what you need to move forward, which is the authorization to cut that check. Mm-hmm. All right, so that was the USA, 10,000 more confirmed cases or above, and then I included Maryland as well. Remember this one. This is a good source right here that's out. You should follow them on Twitter to see those numbers either rise or fall. But again, I'm optimistic and I hope that they do get to the point of being able to actually address it. Next source here, I was to understand the economic impact of payment. And so we know that they can get the information down to include taxpayers. So therefore they can get the race and they can also do the class thing by household. I mean, by income level, by household and per capita. And so they can see these same things. I'm not asking them to look at that. I'm asking them to provide it and to be able to make that assessment based on the information that's most relevant. Here, I'm gonna have to do an entire new stream just based off of this one IRS plan. 50 million Americans to receive first stimulus payout, because there were African Americans who argued against me when I was saying 40 million African Americans should receive a check. I was talking about African Americans, but they argued me down when I was saying cut the check for reparations. And now you'll see here 50 million Americans to receive the first stimulus payout. And so what gives? Anyway, what I say be fact. Sometimes it may go right over everyone's heads, but I know here in the B1 network, I'm in a comfortable space just to speak freely and to do so. And hopefully I didn't say anything that's incriminating. You know, you got the facts, and hopefully they didn't, you know, disregard it due to the emotional context that I put in it. But to each their very own, it's facts. I'm going to give you the next major source here. As I was doing my research for the 1940s to 60s and thinking about our elders, I want to give you this guy here real fast, if they will allow it.
Book and the serial rights, which many of you were good enough to purchase also. In the practice of law, and I'm not claiming I was worth it, but apparently former vice presidents or presidents are worth a great deal to law firms, and I did work pretty hard. But also in that period, I earned between $100,000 and $250,000 every year. So that when I, in 1968, decided to become a candidate for president, I decided to clean the decks, and at 68, decided to become a candidate for president.
There it is.
Decided to become a candidate.
That's the one.
So that when I, in 1968, decided to become a candidate for president, I decided to clean the deck. In 1968, decided to become a candidate.
You can't just have Richard Nixon. That dude ain't finna just end my live stream like that, man. You out of your freaking mind. Letters from Birmingham jail, though, that could be a good outro. I will give you this. Dr. King was actually born in 1929, did his underwork at Morehouse around age 14, attended the Integrated Theology Seminary in Chester, Pennsylvania, one of 6 Black pupils among 100 students, and the president of class, won a fellowship to Boston University for his PhD. And yet he would have walked into one of those northern hospitals and been denied access to healthcare. He could have been in the streets, and there is nothing they would have been able to do about it. The savings crisis and the need for holistic solutions is another resource that I'm looking at to become more informed. It was available by prosperitynow.org, and it looks at the class argument, and that source as well. It looks at moderate income, even low wealth families, and we know this pertains a lot to our families and our elders' situation. And so I would say they don't have to have the class conversation. They can have the race conversation and make it very specific. Yes, they can. They can move right on by this because all of the information is already available. It would only confirm that they already know to be true. Found one looking at some doctors and organization there, HISS, back in March 2nd. They were having an annual conference. We know that it was given that order. You know, we don't from the global level, and they did not listen. At that time, I thought it was important to include The disease had already killed 2 Americans near Seattle, Washington, and more than 3,000 people worldwide. Those because I see where it was, and now we see where it is today. Did want to give another story to drive that point home. Life Sciences, medical-economics.com. So I like how they coupled medical and as well as economics, because many of us could not afford to get the care that we would actually need if freaking lung collapsed. So the coronavirus response, CR eases on HIPAA enforcement during pandemic. That's what stood out to me, was that in order to answer this same question on civil rights, they've already relaxed HIPAA enforcement. So they've already made it easier to protect the doctor from those lawsuits or those individuals who would claim they were discriminated against, those individuals who would say privacy was not respected, or those who said, this doctor had the duty to report it and told me to stay home, and conditions got worse. All right. Talks about some of the rules that they talks about the penalties, talks about the enforcement mechanism. Do want to drive a source here for the music that we listen to during this live stream. That is R&B super producers. And I actually have the contracts for the music that I was actually playing, but they have an air bit, and their music is fire. I would say so. And that is the information that I brought out, or I used their contracts there to provide it. Next one was just a quick search of who the other top dogs were. That is Steve Mnuchin, Mr. Cut Check himself. I would not have the conversation around Cut the Check if I wasn't going to big dox the individual who actually has to cut the check. And so when I say cut the check, that is Steve Mnuchin on our side. But that Bond villain, it says cut the check, reserve notes. So I love this story here by, even though it's just smut pop literature, that's not what we're actually love the story. Had to filter that out from the presentation, just to keep it streamlined, but it was there and it was available. Also shout out this one right here as a resource, Adobe. They have some stock images that were actually available. You can buy the license for a certain period of time, and I was able to use one and put it into Adobe and dissect it and make it of the presentation. So Adobe is another good source of information. And when I say that, there are like some topics or titles that you can put in and have a PowerPoint or the image already created for it, something like these that actually works in real time. Man, it is a phenomenal tool as we continue to get the message out and inform us, and also to keep that chronicle rolling. I'll give you another one here, a source. This one I didn't use in the story itself, but it was important, right? So I was thinking about big docs and the type of big docs that happened. And I had a whole story there prepared about Michael Vick. But then I just realized, man, this is getting absolutely too petty. I was going down this line for a minute, though. And so because I did think about it, I'm going to put it there, show you some of the information that I was pulling, which is definitely there. The big doc that happened to Michael Vick, I'm sure you all are already familiar. The indictments that were brought, the gambling ring and all of that. Man, that's I'm going to have to on it anyway. But that was a big one. And then came to the doc for that case. Actually find people who were involved in the documenting of it. And you know me, I'm B1, so I'm looking to see if there were any African Americans who played a role in that docking or that snitching on the homie for his role in that dog fighting ring. Now, I don't know how to feel about this one because I'm a dog lover, but I also understand the fighting spirit, the fighting spirit, And so I do believe that the fighting spirit is not just in humans, but that is a metaphor for many mammals, and then even for other things such as the coronavirus itself, I would say may possess a fighting spirit inside of its nucleic acid. But in here, or that will to survive and thrive. But inside of this one, there was a lot that was said. The big thing that I was looking at was how they looked at the inner city. Whenever they wanted to find dirt in the inner cities, they are always able to find some type of informant, some type of snitch, some type of somebody who can provide more information than that was needed. But if it's something on healthcare and healthcare disparity, they don't have people who are willing to put in that level of research. So I made sure I put all of that level of research in, but I did want to at least provide some level of entertainment to with entertainment that I would provide would still have to meet my own moral conscience, my own standard, my own thresholds. And so that's going to be hard. I am super picky, and hey, I'm unforgiving when it comes to it. But there were a number of stories that were actually published there and that doxing that are still even relevant today that annoy my soul, but they are very real. Bye.